Fatty liver disease is arguably the most common liver disease in the world. In fact, recent estimates suggest that it affects up to 1/3 of the world's adult population. This number has been steadily rising in recent years, mainly due to more people consuming too many sugary foods and drinks, fatty foods, and more cases of obesity, diabetes, and sedentary lifestyles. In this video, let's learn about some natural and effective ways to potentially reverse fatty liver disease and get your health back on track. So sit back, relax, and let's get started. Number 1. Coffee. While not a cure, moderate coffee consumption might be very helpful in managing fatty liver disease. Black coffee is particularly rich in caffeine and chlorogenic acid. Caffeine has been shown to work by blocking adenosine receptors in the liver, which can reduce inflammation and fibrosis. It also helps regulate insulin sensitivity and fat metabolism. While chlorogenic acids have antioxidant and anti-inflammatory properties, they may also help prevent fat accumulation in the liver by increasing fat burning and reducing insulin resistance. A 2017 study found a 21% lower risk of non-alcoholic fatty liver disease for regular coffee drinkers taking 2 to 4 cups daily. Another study found that higher coffee intake was associated with reduced severity of fatty liver disease in overweight people with type 2 diabetes. However, it is important to note that decaf coffee may not provide the same benefits as regular black coffee, as much of the coffee's beneficial effects on the liver come from caffeine. Number 2. Probiotics. Probiotics are basically live microorganisms, mostly bacteria, that offer many health benefits when consumed. Probiotics have been shown to modulate the gut immune response, potentially reducing inflammation, which is a key driver of fatty liver disease. They can also help strengthen the gut barrier, preventing harmful substances from reaching the liver. Some probiotic strains can even affect fat metabolism, potentially lowering fat accumulation in the liver. Studies show that probiotics may be effective at preventing and delaying the progression of non-alcoholic fatty liver disease. In fact, one study reported a 17% reduction in liver fat content after 12 weeks of probiotic use in NAFLD patients. In addition to supplements, you can incorporate probiotics into your diet through fermented foods like yogurt, kefir, kimchi, kombucha, sauerkraut, and fermented cabbage. But always consult a healthcare professional for personalized recommendations according to your individual needs and condition. Number 3. Good fats. Good fats are mostly unsaturated fats that are found in foods such as nuts, seeds, avocados, and fatty fish like salmon and tuna. These fats can help reduce inflammation in the liver and improve insulin sensitivity, which can help prevent the accumulation of fat in the liver. In fact, according to a 2020 study, replacing saturated and trans fats with monounsaturated fatty acids, which are found in sources like olive oil, avocados, and nuts, was linked to a 20 to 40% reduction in liver fat content compared to high saturated fat diets. Excess weight is a major risk factor for fatty liver disease. Good fats can help you feel fuller for longer, reducing your overall calorie intake and helping you lose weight. A 2019 study shows that replacing saturated fats with monounsaturated fats led to a 3 to 5% weight loss over 6 months. While good fats offer numerous health benefits, moderation is key. Consuming too much of any type of fat can lead to weight gain, so focus on incorporating good fats into your diet instead of unhealthy fats. Number 4. Fiber-rich foods. A 2017 study suggests that increasing fiber intake by just 10 grams per day can reduce liver fat by up to 5%. Fiber is basically of 2 types. Insoluble fiber acts as a food for your friendly gut bacteria. These bacteria produce short-chain fatty acids as a byproduct, which can reduce inflammation in your gut and strengthen your immune system by potentially killing harmful kinds of bacteria. Another type is soluble fiber. It combines with water and becomes gel-like. This gel-like consistency traps cholesterol and unhealthy fats in your food, preventing them from absorbing and entering your bloodstream. The recommended daily fiber intake for adults is 25 to 35 grams. However, if you have fatty liver disease, aiming for 30 to 40 grams per day may be even more beneficial. But do that gradually and in small portions, because too much fiber at once can increase your risk of bloating, gas, or other digestive issues. For a fiber-rich diet, opt for whole fruits and veggies like berries, apples, broccoli, carrots, and leafy greens. Aim for at least 5 servings per day. Additionally, swap refined grains like white bread and pasta for whole wheat options like brown rice, quinoa, and oats. Number 5. Milk thistle. Milk thistle, with its prickly purple flower and white-veined leaves, has been traditionally used for centuries as a natural remedy for many liver conditions. It contains a compound called silymarin, which has powerful antioxidant and anti-inflammatory properties. Its antioxidant effects can protect your liver cells from damage, and its anti-inflammatory properties can lower inflammation in them, allowing the liver to heal. In fact, a 2020 study showed that silymarin from milk thistle, when combined with lifestyle modifications, resulted in a 29% greater reduction in liver fat content compared to lifestyle changes alone. Plus, it showed a 17% improvement in insulin sensitivity compared to lifestyle changes alone. But if you have a fatty liver, consult with your doctor about whether milk thistle might actually be a suitable addition to your diet and doesn't interact with any medications you might be taking. Number 6. Weight loss. Weight loss is key to preventing complications of fatty liver. When you lose weight, particularly belly fat, your body starts burning stored fat, including the fat accumulated in your liver. This can lead to a decrease in liver fat content, potentially improving liver function and reducing the risk of complications. In fact, according to a 2017 study, fatty liver patients who lost 10% of their body weight noticed a 75% reduction in liver fat content and significant improvements in liver enzymes and insulin sensitivity. So perhaps you can imagine how effective and how crucial it is to lose weight, whether you have a fatty liver or not. Number 7. Stay hydrated. Water helps our body break down fats, transport them to the liver for processing, and flush out extra or processed fats via urine or feces. Dehydration, on the other hand, can impair this process, contributing to fat accumulation. A 2017 study in the World Journal of Gastroenterology found that increased water intake, about 2 liters per day for 12 weeks, led to a reduction in liver fat content by 5.4% in people with a fatty liver. So, always respond to your thirst signals and keep yourself hydrated to speed up your recovery process. Number 8. Regular exercise. Regular exercise doesn't just help you lose weight, it can do a lot of other things. Regular exercise can increase your metabolic rate, meaning your body burns more calories even at rest. It also helps to improve insulin sensitivity, further improving your body's ability to utilize sugars and burn fats. Particularly aerobic activities like brisk walking, cycling, or swimming burn more calories and promote fat metabolism. This can effectively reduce liver fat content by as much as 30% or more. Aim for at least 150 minutes of moderate-intensity aerobic activity per week. Remember, consulting your doctor before starting any new exercise program is crucial, especially if you have any underlying health conditions. Number 9. Stress management. Chronic stress can be a silent contributor to fatty liver disease, as chronic stress elevates cortisol, a stress hormone that promotes fat storage, particularly around the liver and abdomen. A 2017 study found that mindfulness-based stress reduction led to a 5.8% decrease in liver fat content in people with a fatty liver. Practices like mindfulness, meditation, yoga, tai chi, and deep breathing exercises can help you detach from stressful situations, promoting relaxation and lowering cortisol levels. So if you have a fatty liver, talk to your doctor about developing a personalized treatment plan that includes stress management strategies. Number 10. Regular checkups. Early detection of worsening liver function or complications allows for prompt intervention, potentially preventing severe liver damage. Your doctor may recommend regular blood tests like checking liver enzyme levels, cholesterol, and blood sugar to help identify signs of inflammation, fibrosis, or other complications in the liver. They may also recommend imaging tests, such as ultrasound, MRI scan, or fibroscan to assess liver fat content, scarring, and stiffness, which give a more detailed picture of liver health. The recommended frequency of checkups depends on the severity of your condition and individual risk factors. Your doctor might advise you on an appropriate schedule, potentially ranging from every 3 to 6 months to yearly if your condition is stable. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.